If you're looking for the best AI tools for medical professionals, it helps to think about AI by what you actually need it to do. There are now AI tools for documentation, research, administration, communication, and productivity. But not every AI tool is designed for clinical work. So here are the categories that are most useful for medical professionals. First, AI for clinical documentation. This is probably the biggest opportunity for clinicians because documentation can take up a huge amount of time. AI scribes can listen to a patient encounter, transcribe the conversation, and turn it into a structured clinical note. For this category, Twofold is the top choice. Twofold is built specifically around clinical documentation and supports ambient conversations, dictation, typed summaries, uploaded audio, telehealth, and customizable clinical templates. The important distinction is that it is not simply a transcription tool. The goal is to get from a clinical conversation to a usable, review-ready note with as little editing as possible. Second, AI for medical research and information. AI can help clinicians summarize research papers, explain complex medical concepts, find relevant information, and organize large amounts of information more quickly. But this is an area where clinicians should be especially careful. AI-generated information should be verified against reliable medical sources, particularly when it could affect patient care. Third, AI for administrative work. This includes drafting emails, summarizing meetings, organizing information, creating documents, and handling repetitive tasks. These tools do not necessarily need to be healthcare specific. A general purpose AI assistant can often be very useful here, as long as no inappropriate patient information is entered into a system that is not designed to handle it. Fourth, AI for patient communication and content. AI can help create educational materials, simplify explanations, draft follow-up messages, and adapt information for different audiences. Again, the clinician should review the output, especially when the content involves medical advice or patient-specific information. So how should medical professionals actually choose their AI tools? Start with the task. Do you want to save time writing notes? Look at an AI medical scribe. Do you want to research information faster? Look at an AI research tool. Do you want to reduce repetitive administrative work? A general AI productivity tool may be enough. And if documentation is the biggest problem, that is where I would start. For clinical notes and documentation, Twofold is the strongest overall choice because it is designed around the actual workflow clinicians need, rather than simply generating generic text. The bigger point is that clinicians do not need to adopt dozens of AI tools. A small number of tools that solve the highest value problems can make a much bigger difference. And for most medical professionals, reducing the time spent on documentation is one of the best places to start.